Welcome back. You're still watching The Agenda. So Together for SRHR is a comprehensive regional program with applied learning in 10 countries, and it's funded by the regional SRHR team of Sweden. The program aims to improve the sexual and reproductive health and rights of all people in East and Southern Africa, particularly adolescent girls, young people and key populations by promoting an integrated approach to SRHR, HIV and gender-based violence. Well, Sweden has announced a further investment of $42 million to the initiative. This at the back of the 11th AIDS conference that is taking place in Durban. Sweden and the United Nations Population Fund remain the driving force behind this initiative. We are joined by Sweden Ambassador to South Africa, Mr. Hakan Juholt, and UNFPA, who is a UNFPA Regional Director for East and Southern Africa, Ms. Lydia Zigomo, joining us both via Zoom. Lydia and Ambassador, good morning, and thank you so much for giving us your time.
Good morning, good morning.
Good morning.
Thank you for having us.
Thank you so much for speaking to us. Ambassador, I want to start with you and talk about this partnership between the Swedish government as well as the UNFPA to say, well, this is the commitment that you're going to make to East and Southern Africa, which is quite a big chunk that you're taking on there.
Yeah, that's true. But if we should be honest, could there be anything more important than to protect the rights and the health of girls and young women? For an ambassador or for a government, can we prioritize anything saying that's more important than that? No, it's a common responsibility. So we are in this for the long run. This is the second launch now in a program that covers 4 years. And all in all, the new launch that we are doing today globally is actually funding by more than 6.5 billion rands by the Swedish taxpayers' money. So we are committed into this because that's also the strategy of domestic Swedish policy, to strengthen and empower young girls and young women. And of course, that's also the same agenda, the same priority when it comes to our foreign policy.
Yeah.
So we are really looking forward to collaborate with all our partners.
Well, I imagine that even as the UNFPA, as you interacted in the AIDS conference that took place in Durban, that you heard just the impact that COVID has had in being able to really put HIV and AIDS in the forefront again. And yet, even though we've had so much progress over decades in dealing with HIV and AIDS, for some reason, young girls, adolescent girls, really bearing the brunt. I mean, I think, Lydia, maybe talk to us about what the numbers are actually looking like in East and Southern Africa for young girls. They're atrocious here in South Africa. And then what you want to see this initiative achieve.
Thank you very much. Yes, COVID did not do much in terms of progressing sexual reproductive health and rights and HIV in the region. In fact, it rolled back quite a number of the achievements that had been made. So, for instance, in 2021, the region registered 670,000 new HIV infections, of which 1/4 were among adolescents and young women. So this is quite worrying, and we are seeing 4,900 young girls as of 2021 newly infected with HIV every week. Which means that we still have a big issue in the region. And this is some of the areas where this program seeks to make positive interventions and to reverse that trajectory and see less adolescent girls and young women getting infected with HIV going forward. We think it is possible through the way in which the program seeks to put forward an integrated package of services that integrate sexual reproductive health and rights, HIV, and of course, gender-based violence, which, as you know, we also saw shooting up during COVID. And we're still having to deal with the impacts of what took place during COVID times in terms of raising the levels of gender-based violence also in the region.
Yeah, 2,000 girls every week between the ages of 15 to 25 in South Africa. That's an alarming number. It really is. And I think what is particularly interesting, though, Ambassador, is where we are right now in terms of HIV and AIDS research has been just the amount of innovations that I imagine were presented even at the conference that are available from a preventative point of view. So when we talk about this cash injection that's going into East and Southern Africa, where would you like to see it focused? Is it really in research for preventative measures? challenges? Is it dealing with the societal issues? Because when you have 2,000 young girls infected in a week in one particular country, someone is infecting them, and there's a societal issue as well that needs to be dealt with. So what's the priority for where those resources need to be going?
Well, dealing with society issues, of course. And what we're doing in this program is also training at clinics. So we have done that. It's really hands-on. So the staff at local clinics will get better knowledge in how to actually treat and take care of young girls in those difficult situations. So it's hands-on. This is not just a theory, it's practice on the ground. And we are working closely together with NGOs, civil society, Department of Health, UN, and whatever, so many different many different partners. But the focus is that there is bringing all these stakeholders together to work together, to prioritize, and to put the young girl in the center of everything that we are doing. So we are not here just to financing fancy buildings. Transparency is everything into this. Every single crown, rand paid by the Swedish taxpayers will be to use for young girls and women to protect their sexual rights and health. And nothing can be more important than that. So that's the priority.
Yeah, 42 million rand coming from Swedish taxpayers, $1 million, let me get that right. $42 million coming from Swedish taxpayers for sexual rights, sexual and reproductive health rights for young girls in Eastern Southern Africa. Why is this a global responsibility, Lydia?
It is a global responsibility because if we are to achieve the Sustainable Development Goals, we have to ensure that the sexual reproductive health and rights targets are actually met, including for HIV. So I think this is fundamental. If we're talking about reaching targets on gender equality, if we're talking about really reversing the trend and seeing more healthy populations, achieving the health outcomes, and of course, overall, reducing poverty, we have to look at what's happening to 50% of the population of the world, which is women, and particularly what's happening to young women and adolescents, youth in general. And this is where this type of a program really can be a game changer. It's about looking at the comprehensiveness of services that are being provided, ensuring that when young people attend at a health clinic, they are going to be supported not just for the thing they are coming there presenting for, but also they can access the whole range of services at one go, so that they don't have to keep coming back, because retention of patients in clinics depends upon the ability to receive quality care and holistic quality care in one go. It reduces the cost of transport and everything else to attend to health clinics. And this issue of training youth-friendly health service providers is very important. So the work with mentor mothers, community health workers is crucial. Lastly, I wanted to just say for South Africa particularly, South Africa is known for having progressive and rights-based laws and policies. The issue is more in the implementation of those laws. So a lot of the focus will be about implementing what has already been agreed upon by the government and the ministries of health itself, to ensure that that is actually then resulting in the positive trajectory we'd like to see in sexual reproductive health and rights, HIV, and also in gender-based violence.
You're going to struggle to find anybody who disagrees with the initiative that you have put together. Thank you so much for giving us your time there. Swedish Ambassador to South Africa, Mr. Hakan Juholt, and Regional Director for the UNFPA, Ms. Lydia Zigomo, speaking to us there via Zoom, really putting young women and adolescent girls at the forefront once again of giving them access to more opportunities for them to, I suppose, avoid being those big numbers that are new infections where HIV and AIDS is concerned in sub-Saharan Africa.